So we're going to be talking about why someone goes into anaphylaxis and how we can support them afterwards with our auto-injectors. So this is someone's arm, and we have our allergen at the top here, which in this case is bees. So in our body we've got histamines which are floating around, and they fight against the things that can cause us to go into anaphylaxis reaction. So for this example, this person's got an allergy to bee stings or wasp stings. Bee number one comes along and will sting the person, and you might get a little bit of localised swelling. But the first time that someone comes into contact with their allergen, they're very unlikely to have a reaction. And quite often you hear parents say, oh, but they've eaten strawberries before, or they've eaten dairy before and not had a reaction. The first time the body's just getting prepared. So in a normal person, you'll have a certain amount of histamines collecting to swell up around this area to stop the toxin spreading around the body. Someone with an allergy, these histamines, or without an allergy, these histamines would then remember that and then disappear, ready for next time. Someone with an allergy, they would have the standard amount of histamines, but they would also have some extras. So the body's gone into sort of an overreaction mode. So they will still only have that small amount of swelling, but they won't have a huge impact. Next time they come into contact with their allergen, they come and get stung again, but these ones haven't disappeared. So on top of that, they've also got the normal histamines, plus the allergen histamines, because they've got an allergy, and their body is now responding in a much more severe way. So you're going to see significantly more swelling, sweating, increased heart rate, but much, much higher than the average person. By the time the third allergen comes along and stings them, you have now got thousands and thousands of histamines in the body, all going into panic mode, saying that this person's had an allergic reaction and we need to stop the toxin spreading. So what it does is it starts to swell up different parts of the body to stop the toxin moving through. However, what it's then doing is also stopping oxygen and blood moving through the body, hence why someone's lips, airways all swells up. So again, rather than just a little swollen bite that we've all experienced in summer, you've got the whole body swelling up, you've got their eyes are watering to try and get rid of the toxins, you've got their lips swelling up, can't draw lips, and you've got their throat and various other things sweating, all means that you're going to notice the body is trying to get rid of something. So Chrissy would have already gone through with you what you do with someone when they're in anaphylaxis, and one of the best things you could do is get them down to the floor, slowly sit them up when they come round if they do recover from this. But generally you need to make sure that their airways are as clear as possible. If they do go into cardiac arrest, then obviously you need to use your first aid skills. So when we're looking at anaphylaxis and auto-injectors, we've got three different auto-injectors that you'll come across. So we've got Emerald, and these, a lot of people call all of these EpiPens, but they're auto-injectors. EpiPen is just the brand of this one. Emerald's made in the UK and is very, very similar to an EpiPen with regards to manufacturing and the adrenaline that's inside it. With this one, you take off the lid and you've got the needle sat behind a little push end there. With EpiPen, these ones are made in Australia, and these ones, you always remember blue sky, orange to the thigh. With the EpiPens, you've got instructions on the side, and as I said, they're very, very similar to Emerald. And EpiPen keep having episodes where they haven't made enough, and so sometimes you'll get alerts if you've got anyone with these that say you can use them 3 months past the expiry, or someone might be changed over to an Emerald because they are so similar in property. The other one, which is not as commonly on the market but very, very good, is the Jext. These ones have yellow tops and black bottoms, and if any of you are practicing with these ones, please do be careful, because there is a plastic rod just inside that can really, really sting as it hits your thigh. It's not a needle, it's just a little plastic end, but it does give you a little bit of a jump as you throw it into your thigh. So with all these three, we need to make sure that we are using them safely. So always, always, always hold it in a fist, never like this, because as you're panicking and you're all shaking, you've grabbed it, you're not only going to stab yourself, but you're also going to lose a dose of adrenaline that the person potentially needs. So always hold it, fist around, never like this. That doesn't allow you extra pressure. Palm of your hand in your fist. Anyone can give auto-injectors. It's on the medical register as a part where anyone can give it, but they recommend as long as the person's trained to do so. In reading the side, you are classed as trained to do so. Now you can see with these, there are certain differences. So on the Emerald, it says it needs to be in the thigh for 5 seconds. On the Jext, it says 10 seconds. And on my one here, I think it says 10 seconds for the EpiPen, but that has recently changed, I think, to 3 seconds. I just haven't updated my kit. So because they're all different, we always go with the rule of 10. So regardless of which one you're looking at, always go with the rule of 10. So that's 10 centimetres away from the thigh, 10 centimetres in, and then 10 seconds, 10 centimetres away from the thigh, 10 seconds it's in, and then massage for 10 seconds. So 10 high, 10 thigh, 10 massage. So with this one and the EpiPen, with both of these, you have to remove the safety cap before you can administer it. And with the Emerald, as I explained earlier, you have to remove the actual needle end. All of them have protective sheaths, so once it's been administered, you will not be able to get to the needle again, and that is almost like using your sharps box. So, if I can get this back on, I'll show you with the EpiPen. So always go on the right side of the body first where possible. The length of these needles will allow you to go through denim, they'll allow you to go through anything. Bike leathers, probably you might have to remove, but they can go through really thick denim, waterproof trousers, all kinds of stuff. Take the cap off, get the person with their right hand side exposed, and we're not going on the side, we're not going on the top, we're kind of going down the middle there. 10 centimetres away, with force, apply it into the leg. 10 seconds, release, and then massage for 10 seconds. With this, we are now putting the cap back on the end, give it to the person to take to hospital, and write on their hand which side you administered and what time it is. They can then take that to the hospital with them and they'll see their dose. If you need to administer a second one, you get your dose again and you do it on the opposite side. We aim for the right first because this is the one that's going up to the heart, and then the heart will then spread it around the body so it'll get to them quicker. So if they need a second dose, then it will be on their instructions, usually 10 to 15 minutes later. Make sure your thumb's not over the end, palm of your hand, 10 high, 10 thigh, 10 massage. Again with the second one, put the cap on, right on the same hand, because they might miss if it's written on different hands. Put on the same hand, right leg, and then the time you administered it, send them to the hospital with this, and the hospital will dispose of it and support them to order a new one. Any questions, please ask your training instructor. Have a good session.